Hello everyone, my name is Furman Cybron and I will be presenting to you Guillain-Barre Syndrome. So, what is Guillain-Barre Syndrome? It is a rare disorder in which your body's immune system attacks your nerves. The damage prevents the nerves from transmitting signals to your brain, causing weakness, numbness, and paralysis. There are three types of Guillain-Barre: acute inflammatory demyelinating polyradiculoneuropathy. This is the most common. Is muscle weakness that starts in lower part of your body and spreads upwards. Most common in North America and Europe. Miller-Fisher syndrome, paralysis starts in your eyes. Most common in Asia and associated with unsteady gait. Acute motor axonal and acute motor sensory axonal are less common in US, but more frequent in China, Japan, and Mexico. Because Guillain-Barre doesn't attack a specific set of nerves, but attacks whichever nerves. In each person affected by Guillain-Barre, it attacks a different set of nerves. So your symptoms can be different. You can get prickling, difficulty with your face, maybe your eyes, have double vision, difficulty with your bladder or bowel movements, rapid heart rate, difficulty breathing. But the most common symptom of Guillain-Barre it often begins with tingling and weakness starting in your feet and legs, moving upwards to your arms and upper body. If this happens to you, contact your doctor right away. But what causes Guillain-Barre? There's no known direct cause for it, but Guillain-Barre has appeared in those who have recently healed from respiratory or digestive tract infections, or people who have gone under surgery or have received vaccinations. But those are more rare cases. But how is it diagnosed? There's three different ways. You can get a painful spinal tap, which they remove fluid from your spinal column in your lower back and they test it for Guillain-Barre, or they do electromyography. They stick you with needles and test out your nerve activity, or nerve conduction studies where they shock your nerves to measure the speed of your nerve signals. Medical intervention. There's no known cure for Guillain-Barre. Those affected by Guillain-Barre can reduce the duration of illness through different treatments, such as plasma exchange, is ridding your body of plasma of certain antibodies to encourage your body to produce more of it, or through immunoglobulin therapy. Patient is given healthy antibodies from blood donor. Physical therapy intervention. Because Guillain-Barre affects each person differently, it is imperative that the PT does a thorough evaluation of the patient and the caregiver. The physical therapist and PTA have to keep in mind that Guillain-Barre is especially mentally and emotionally taxing on the person who is affected. Some of these people have been wheelchair bound for 6 months. Some of these people have become totally dependent on others because their body can't move on command anymore. So the goals of physical therapy are to achieve optimal muscle strength and ROM and to relieve pain and return and to get those nerve supply returned. And to use supportive equipment and other functional adaptations to help patients with residual impairments to resume an activity level that is close to their previous lifestyle as possible. That just means we're trying to get our patient back to be the most independent as they can. Tips for the physical therapist. Expand the activities gradually. Let's increase repetitions, not resistance. We want to avoid injuries. Um, Most people affected by Guillain-Barre, their whole life has changed. They can't do certain things anymore. Everything they have to do has to be approached from in a different way. So it's imperative that the PT teaches their patient, how to do things differently now. And it's also important for the caregivers to be taught by the physical therapist in proper body mechanics for transfers and positioning to prevent injuries. This is just a physical representation of Guillain-Barre. The top nerve is one that hasn't been affected, and the bottom one is the deteriorating one. These are my references. Thank you for coming to my TED Talk.